Understanding how the NCLEX is scored and what happens if you don't pass on your first try is essential for staying motivated and prepared. In this lesson, you'll explore how the nclex works, what your results mean, and how to prepare effectively. You'll learn how the computer adaptive testing system works, what the pass-fail outcomes mean, and how often you can retake the exam. Lastly, how to create a study plan aligned with your goals. NCLEX scoring, pass rates, and retake policy. Scoring overview. The NCLEX uses computer adaptive testing, and the test ends when it has enough information to determine with 95% confidence whether a candidate is above or below the passing standard. How do you pass the NCLEX? You pass if you consistently show that your ability meets or exceeds the passing standard. You fail if your performance is consistently measured below that standard. Now, let's talk about your score. You won't get a numerical score like in a typical test. Instead, you'll receive a pass or fail result, and if you don't pass, you'll also get a candidate performance report, which shows how you performed in each test category. Now that you understand how NCLEX scoring works, let's look at the different ways the test can end. Here are the scenarios, and what each one means. Minimum questions, 85. If you clearly pass or fail early, the test can end after just 85 questions. Maximum questions, 150. If your ability level stays close to the passing line, the test continues until the full 150 questions. Time runs out. If you run out of time, your result is based on how you performed on the last 60 questions. All questions answered. If you complete all the questions within the time limit, your final result is based on your performance across the entire test. Now let's look at the NCLEX pass rates for 2024. These pass rates are categorized into nclex-rn and nclex-pn, showing the average performance by candidate group. First-time U.S. educated, repeat U.S. educated, international candidates. For first-time U.S. educated candidates, the estimated pass rate is about 85% for nclex-rn and 82% for nclex-pn. For repeat U.S. educated test takers, the rates drop to approximately 45% for nclex-rn and 40% for nclex-pn. And for international candidates, pass rates are estimated at 40 to 50% for nclex-rn and 45 to 55% for nclex-pn. Therefore, the data shows that first-time test takers, especially those who are U.S. educated, have the highest chances of success. But what if you don't pass the first time? Let's talk about the retake policy. If you fail the NCLEX, you can retake it, but you must know the following. You may retake the exam after 45 days, and you're allowed up to 8 attempts in 1 year, depending on your state board's regulations. Each time you retake the exam, you'll need to reapply through your state board of nursing. You'll receive a candidate performance report showing your strengths and weaknesses, specifically the client needs categories where you scored above or below the passing standard. This report is essential for shaping your remediation plan. It helps you focus on the areas that need the most improvement before your next attempt. Now that you've learned about NCLEX scoring, pass rates, and the retake policy, let's focus on how to use this course and study effectively. Follow the course structure in order. This course is broken into sequential, bite-sized modules. Start with strategy and exam overview. Move into content review, like adult health, pharmacology, and more. Then, apply your knowledge with next-gen case studies. Finally, test your readiness with full-length mock exams. Each lesson builds on the last to reinforce clinical reasoning and boost your confidence. Recommended weekly study plan. Here's a recommended 10-week study plan, categorized by number of weeks and focus areas. Weeks 1 to 2. Start by learning the NCLEX format, test-taking strategies, and core safety concepts. Weeks 3 to 4. Focus on medical surgical nursing and pharmacology. Weeks 5 to 6. Move into pediatrics, OB, psychology, and community health. Weeks 7 to 8. Build your clinical judgment skills and practice with next-gen NCLEX items. Weeks 9 to 10. Finish strong with full-length practice tests and review your weak areas. Now that you've seen a recommended weekly study plan, let's talk about how to get the most out of each week. To stay engaged and reinforce what you're learning, rotate through study methods like video lessons, note review, practice questions, and reflection with rationales. To study effectively, focus on strategies that build long-term retention and sharpen your clinical judgment. Use active recall. Quiz yourself instead of rereading. Do 20 to 50 practice questions daily and review the rationales. Use NCLEX-style language in your thinking. Prioritize, assess, delegate. Don't skip NGN case studies. They now make up a significant portion of the test. Track your weak areas using the client needs categories, covered in Module 2. Now that you know how to study effectively, the next step is to stay aware of common pitfalls. Staying aware of common pitfalls can help protect your progress and keep your preparation on track. Here are some common pitfalls and how you can avoid them. First, passive reading. Simply rereading material isn't enough. Instead, use flashcards, write notes, or teach the content out loud. Next, focusing only on content. While content is important, make sure to also review test-taking strategies and strengthen your clinical reasoning. Ignoring NGN is another common mistake. Be sure to complete at least one next-gen item set each week to build familiarity and confidence. And finally, cramming. Avoid last-minute studying. Instead, stick to a consistent study plan that spans 6 to 10 weeks. Now, as your exam date gets closer, plan your final weeks wisely to reinforce strengths, reduce stress, and boost exam readiness. Follow this timeline to stay organized and confident. 2 weeks before your exam, take a full-length practice test under timed conditions. 1 week before, focus your energy on trouble areas and do some light review to reinforce key concepts. In the final days, avoid burnout. Get quality sleep and stick to reviewing only high-yield content. You've just covered one of the most important parts of your NCLEX journey, understanding how the test is scored, what to do if you need to retake it, and how to build a study plan that actually works. By staying strategic and consistent, you're already setting yourself up for success. Let's do a quick recap of what you've learned. The NCLEX uses a computer adaptive testing system with no numeric score, only pass or fail. Test ends based on performance. Minimum questions 85, maximum questions 150-hour time limit. If you fail, wait 45 days before retaking and use the CPR to guide your review. Follow a 10-week plan. Start with safety, build through content, and end with mock exams. Do 20-50 questions daily, review rationales, think like the NCLEX, practice NGN case studies, and track weak areas using client needs categories. Passive reading, skipping NGN items, or cramming weakens retention. Use active methods and follow a structured plan. Take a full-length test 2 weeks before. Review weak areas 1 week before. Rest and focus on high-yield content in the final days.